If you're pregnant and you want to decrease your risk of tearing, or you're interested in learning how to perform a perineal massage, this video is for you. My name is Christine. I'm a pelvic floor physical therapist, and I help women through all walks of life, whether that's pregnant, postpartum, or somewhere in the middle where you just want to learn more about your pelvic floor and improve your overall health. In this video, we're going to talk about how to perform a perineal massage and answer some of the most common questions. Before we begin, let's get through some basics. You should start a perineal massage 6 to 8 weeks before your due date, and you should perform it every day or every other day for those 6 to 8 weeks. You want to find a really comfortable spot at home where you feel safe doing it, and you can either do it yourself or have your partner do it for you. And third, if there are any complications with this, you're not sure if you're doing it correctly, you have any bleeding or severe pain, please stop doing it and contact your medical doctor. Now, let's get into the basics of anatomy. These are your hip bones, this is your pubic bone, and this is your tailbone. Your pelvic floor is the group of muscles that connects from your pubic bone all the way to your tailbone. We have 3 different layers, and during pregnancy, their job is to help support your baby and your internal organs. Now, the perineal area is this area right here that's between your vaginal opening and your rectum. This area is pretty thick, and so massaging it before you give birth can help improve its flexibility so that when it stretches and baby's head is coming out, it's 1, not as painful, and 2, a little bit more flexible to decrease your risk of tearing. One of the big reasons why we do a perineal massage is to help desensitize this area so that when baby's head is crowning, you're not as nervous and you're not in as much pain. You know what it is, you're familiar with the sensation, and you can actually breathe through it. So, 2 options. You can have a partner help you out, and they would use their thumbs to insert and then pull down. Or you can use a device like a pelvic wand or a perineal, where you would insert it into your vaginal opening and press gently down. So it should be gentle but firm enough to feel a stretch here. Now that stretch is gonna feel like you're pulling your 2 lips apart. You know that tingly and tight sensation? That's what that should feel like here too. So you'd put it in, you'd press down, you'd hold that for about a minute or a minute and a half. Make sure you're breathing through it as you do it. And then after you've held it for some time, you're gonna go up into a U, back down, and then to the other side. So I'll show you this way. You'd go in, pull down, hold for 60 seconds or 90 seconds, go up to the side, back to the middle, up to the other side. And you'll do that for a couple minutes. So in total, this should take 3 to 5 minutes. Make sure you're breathing the whole time and you're in a comfortable position. I definitely recommend using a lubricant for this. So if you're using a device, use a water-based lubricant to protect the quality of the device, and make sure you wash it with soap and warm water and that it's fully dry before using it. Same thing with your hands, make sure they're clean before you insert it in. I also recommend doing some exercises beforehand to prep your body. Those exercises would include deep belly breathing, some hip stretches, even like mobility on the Swiss ball. If you're not sure what to do, watch my other videos where I talk about different exercises to help in opening up your hips during pregnancy. If you like this video and you want to learn more, check out my website. I have a guide on pregnancy and preparing for birth. Take care, and I'll see you soon.